A posterior lower leg. Okay, so here's an anterior view. There's a posterior view. We'll look at the gastrocnemius. Okay, in lay terms we call it the calf muscle. All right, this one we have a medial head of the gastrocnemius and a lateral head. Okay, let's go ahead and mark a bunch of structures here. Okay, then we'll isolate. All right, so here is the gastrocnemius. Okay, it does taper into the Achilles tendon and attaches to the calcaneal bone. All right, the origin of the gastrocnemius is the medial and lateral condyle of the femur. All right, so just to orient you again, here is the medial side, and this is the lateral side. So medial head, lateral head. All right, so origin is the medial condyle of the femur. As you can see there, so it does cross the knee joint and it does cross the ankle. So it's got two joints that it crosses. And insertion is on the Achilles tendon and the calcaneal bone. Okay, the lateral head is on the lateral condyle of the femur. That's the origin. And its insertion is on the Achilles tendon and calcaneal bone. Okay, its action is plantar flexion. Okay, so plantar flexion, which would allow you to basically get on your tippy toes. And because it does cross the knee, we do have some flexion at the knee that it will do. Okay. Underneath the gastroc, we have a muscle that's very similar. Okay, and that is the soleus muscle. Okay, it has its origin on the proximal area of the fibula and the tibia. Okay, posterior aspect of proximal tib fib is the origin, and its insertion is on the calcaneal tendon and the calcaneal bone. Okay, so the calcaneal tendon and the Achilles tendon are two different tendons, even though they're in the same area and basically have the same function. Okay, its action is going to be plantar flexion. The expression is you gallop with the gastroc and stride with the soleus. So the gastroc is a very powerful muscle that will allow for, like that basketball jump to really do a layup, more aggressive explosion running and sports, soccer, stuff like that, whereas the soleus is more of a stride. Okay, so that's where the expression comes from. You gallop with the gastroc, stride with the soleus. What ends up happening clinically is the muscles, since they overlap each other. Okay, here's the gastroc and there's the soleus. They can end up adhering to each other, and the soleus starts to take too much pressure that the gastrocnemius should otherwise be taking. So the soleus is the one that gets hurt or tight. Oftentimes misdiagnosed or confused with a gastroc injury, but really it's the soleus muscle. And the test is really easy to figure it out, and the treatment is really easy. Now it's uncomfortable for the person to remove the adhesions and reset the muscle, but once you do, the results are phenomenal. Okay, another muscle in the posterior aspect is